Oh, there it is. I found it. Okay. Good morning, everyone. I'm Sonya Dolan. I'm a co-founder of Mettle Health, and today I'm going to be stepping in for BJ Miller, who unexpectedly had to travel. So I will do my best to play BJ for the day. We're going to be hosting a discussion with Dr. Allison Applebaum, who I will let her introduce herself and why she's the perfect person to talk about caregiving, and we can go from there. But we'll do some introductions. We'll go through some level setting on how to interact with us after this, and then we'll get into the discussion. So, Allison, thank you so much for joining us. I hope you can just introduce yourself and tell us a little bit about you.
Absolutely. Thank you so much for having me, Sonya. I'm so happy to be joining you all and talking about my favorite topic, which is caregivers and caregiving. I am an associate attending psychologist at Memorial Sloan Kettering Cancer Center and an associate professor of psychology at Weill Cornell Medicine here in New York City. And I'm the founding director of the Caregivers Clinic at MSK. This is a program that I began after working at MSK as a postdoctoral fellow and realizing in that work that there were so many parents and partners and children and siblings and friends of our patients with cancer receiving cancer care at Memorial Sloan Kettering Cancer Center who were in need of support. I realized at that time that cancer care and healthcare more broadly was increasingly relying on family caregivers to shoulder tremendous responsibilities without training, education, or support. And I realized that there were no support programs targeting family caregivers in any cancer center in this country, which was just so shocking to me back in 2010. And so in 2011, I began the clinic, whose mission is to ensure that no caregiver experiencing significant distress as a result of their critical role goes unidentified and deprived of necessary psychosocial services. In addition to being a caregiving scientist and clinician and researcher, I'm also a family caregiver. I took care of my father, who lived with Lewy body disease, and have shared parts of my journey with him in my recent book that was published in February called Stand By Me, a guide to navigating modern, meaningful caregiving. Oh, thank you. Perfect. So very excited to talk about all things caregiving today.
Oh, well, thank you so much for being with us. We're thrilled to have you. So we can get started here. So Allison and I are going to go through some slides, some topics that we think are super important to cover when talking about caring for another person. And then after that, we'll go to your questions, which is the kind of our favorite part of this. So you can do that in two ways. You can click on the raise hand button and we'll unmute you and you can speak with Allison and myself. Or if you'd prefer to not do that, you can type it into the Q&A and I'll read it out loud for Allison to address. So again, two ways: you can raise your hand, speak with us, or you can click on Q&A, type it in yourself. Big reminder that's super important here is this is really meant to be a safe space to ask any question or feel that you can bring up anything. There's not a lot of spaces, I feel like, where that is possible, especially when talking about caring for another person and maybe sharing something that feels hard. So we're here for that if that's where you want to go. This is meant to be safe for everyone. So thank you so much for being with all of us. So let's get started. Allison, when we talked about this, these slides, this to me, I think is kind of where the juice is at, this dynamic of patient and caregiver. And when we started Mettle, one of the things that I say all the time is like, it's not just the person who's living with the illness, it's also the people who are caring for them are also living with this illness just in a really different way. Can you talk about what you've seen in the patient caregiver dynamic and what things, what can people be thinking about as they move through this experience?
Yeah, I mean, I agree 100%. This relationship, the relationship in the patient caregiver dyad, it's foundational to the experience of being a patient and being a family caregiver. Whether you're taking care of a partner, a parent, a child, a sibling, a friend, that relationship you have, those relational dynamics are going to be coming into play. I'm going to be talking about bringing a lot of elephants into the room today. And so the first elephant in the room is that these relational dynamics change inevitably when we step into the caregiving role, when we step into the patient role. Often in my clinical practice, folks who are in romantic partnerships with their care recipient will say, I no longer feel like he's my husband. That part of our relationship is gone. I'm just taking care of him. And what I want to say to you, which is what I say to my patients, is that those losses and those changes are very real. I
Mm.
just want to acknowledge that those changes absolutely are real. Whether it's romantic or otherwise, there are shifts in the dynamic. One thing that comes up for all of us is that often before illness, there's inequality in emotional support provided within a dyad. But once illness and caregiving are thrown into the mix, very often caregivers are no longer receiving the type of emotional support they once did from their care partner. At the same time, when they are giving all of themselves, including emotional support to that person. And so there's a very significant mismatch in support received. So I really just want to validate the changes that are experienced. And of course, there are certain illnesses, for example, neurodegenerative diseases like the disease my dad had, brain cancers, or diseases that have neurocognitive changes associated with them, or the treatment has neurocognitive associated changes, that these two lead to very significant changes in the relationship.
Mm.
And these changes are often experienced as losses and should be articulated as such, because otherwise we're just avoiding the reality. What I also want to point out, though, is often I hear, for example, adults taking care of parents saying, you know, we've had a role reversal. I'm now the parent, my dad is now the child.
Yeah.
And I have to say, from my personal experience of a decade of taking care of my father, I took care of everything for him. He was completely dependent on me. Yes, I changed his diaper, but he was never my child. We remain connected to our authentic relationship as parent and child, father and daughter. And I bring that up because when I think about the second phrase there, self-care, I think one of the most important things that we can do as family caregivers in these roles where we do experience the changes, whatever they are, is to think very critically about how we can remain connected to that initial relationship, the underlying foundational relationship. My dad still parented me in a small way, despite being bedbound, despite being dependent on me. He would ask me, "Did you eat breakfast this morning?" He wanted to make sure that I was being cared about. And that was so fulfilling and holding for me and grounding for me. And so I just want to encourage you to consider, if there have been changes in your relationship with your care partner, how can you remain connected to the underlying dynamic that was always there?
Yeah. Do you have suggestions for how to do that? I so resonate with exactly what you were talking about. When I was caring for my mom, I would have these moments, and I don't know if it's necessarily like I became the parent and she became the child. It was just such an unknown dynamic because I had received so much physical, emotional care over my lifetime, and then to be the person to like flip that, it just felt weird. It just felt, but to your
Yeah.
point, it was just a loss of like that piece of this is different now. But do you have suggestions on how to
Yeah.
connect to that original relationship? Because I think that is something that's real, that does happen.
So it takes courage to do this, like most of the things I'll talk about today. But I think it can be incredibly powerful to vulnerably label the change and to
Mm.
say something like, "Mom, I really miss the feeling of XYZ. I know you can't physically do ABC right now, but how can we get back to that?"
Yeah.
And my guess is that your care partner, in your case, your mom, my case, my dad, wants to get back to that part. So I think the best thing we can actually do is just bring it into the room, label it, and talk about it and say, "This is real." And I look, I miss having this feeling with you. I miss feeling touched. I miss feeling cared about. I miss feeling the priority. And I know that right now the focus has shifted, excuse me. But how can we get back just a little bit to that?
Yeah. Well, there's something also for me of just like it just your relationship will change from this point on, and how can we just be open to our relationships and ourselves changing over time anyway, so that then when we get to that point where it's about illness and end of life, like we've already kind of navigated little multiple changes along the way, which is a hard one to take a dynamic that's been set, for like potentially decades and
Yeah.
then completely change it. And to your point, that's a loss that has to be felt. I know you touched on self-care, but like that's such a buzzword, I
Yeah.
feel like for caregivers especially. And we always joke that it's not just a glass of wine and like a walk around the block. Like what is truly building in
Yeah.
care for a caregiver,
Yeah.
not just like, oh, every so often I treat myself to something, but like this is a practice as I go along.
Yeah. So to me, self-care is about preserving energy.
Mm,
That we as caregivers do not have a limitless supply of energy, right? What we have to give is very little after the end of our long caregiving day. And so anything that you can be doing to preserve your energy, whether that is making sure you have quiet time for yourself, saying no to joining some event, getting extra sleep, going for the run, whatever you personally need, it's very unique and personal. What I need is different from probably what Sonya needs, is different from what BJ needs. But to me, really, that self-care deep down is about energy. And
mm,
how do we preserve our supply so we have more resources to give the next day?
yeah. One of my favorite things that has come up in another discussion, but it was about holiday caregiving, was the
Yeah.
word no. And
No
just,
is one of the, yeah. So like, thank you for that. So, I think setting boundaries is one of the most important things that you can do for self-care, right? Saying no. I'll take it a step further, cutting people out of your life who drain your energy,
mm,
right? People who don't buoy you up, who are not giving you energy. Well, then maybe you say no to them and literally say no to spending time and using your energy with them.
yeah, which I think for me goes to the next slide of like, I'm just thinking about communication. And when we talked about communication, it was very much within the care circle. But now I'm thinking about how do you then communicate that to the people who are draining the energy? There's so much boundary setting, I feel like has
Yeah.
communication in it. You might have to text these people, you have to tell them, you have to say no to things. So for me, communication is like the heart of all all of this. How do you find that it can either hinder or help relationships when it comes to patient caregiver dynamic?
Okay. So, well, there's so much in there for me
Yeah.
to comment on. I
Yeah.
don't even know where to start. I'm in a full agreement. So communication is really the bedrock of what it is to be, I think, a family caregiver, right? We are, as family caregivers, the hub of an info flow wheel.
Mm,
We are brokering information between patients, care partners, and healthcare professionals. And although it's not often identified as a key responsibility like the medical and nursing tasks you have and the financial responsibility, but communication, healthcare communication especially, that is a significant responsibility. And I just want to acknowledge it can be very, very challenging.
yeah.
One thing I talk a lot about in my work and in the book is strategies to help us be more effective communicators. Because even
Mm,
for those of us who might communicate for our careers, these,
yeah.
these conversations with care partners about illness, about care, goals of care, advanced care planning, they're overwhelming. I just want to acknowledge they can be very, very difficult. Um, I think in this regard that healthcare communication is perhaps our most important responsibility, especially for those of us who are tasked with stepping into the role of healthcare proxy.
Mm,
So when we are tasked with that role, we are tasked with bringing our care partner's voice into the room when they're no longer able to be their own voice. But the only way that we can actually do that effectively, to bring their voice into the room, is to know what that voice would say. And the only way that we can know what that voice would say, is if we ask. And in order to ask questions about what that voice would say, it invites the most significant elephant into the room, which is death.
mm,
So all conversations about care, about the future, advanced care planning, goals of care, goals of life, all of this, of course, dances around an elephant in the room, which could be very difficult. But these are conversations that I think once navigated and opened can absolutely lead to a increased vulnerability in the relationship, a closeness. I often say that caregivers and patients walk around in networks of silence. That is that, caregivers are worried if I bring up this topic, it's going to really upset him. And I'll say, there's nothing you're thinking that he hasn't already been thinking about, and vice versa. And so the more that we can, as caregivers, find our voice and speak up, the greater the likelihood we're going to find out we're not actually so alone in what we're worrying about. There's so much I want to comment on, but I also just want to say from my personal experience that this communication was so much a driver of my whole experience in caring for my dad. So He had Lewy body disease, which is a neurodegenerative disease that leads to fluctuations in autonomic functioning and consciousness. And so for him, he would have sudden drops in blood pressure and temperature, and he would hallucinate. He would hallucinate for a few minutes, sometimes a few days, up to a week at one point. And of course, he was disoriented when he was hallucinating. And every time I brought him to the hospital, he was hallucinating because the hallucinations would get triggered by UTIs or dehydration, all the things that brought us to the hospital. Yeah. What became so clear to me early on was that without me there as his caregiver by his side to serve as his eyes, ears, and most prominently his voice, there was no way for any members of this passing medical teams to have any idea who my dad, Stan Applebaum, was. It mattered to him what his goals of care were and what his goals of life were. And had I not been that voice for him, he would have died in 2013 as opposed to 2019. And so I just share that because for me, it was almost shocking how important that responsibility was. But it really actually was at the heart of everything I was doing in terms of communication.
Yeah, when you're speaking about that, it makes me want to ask, like, how does that feel? Because that is, the burden is the wrong word, but it's a lot of weight and a responsibility to know I am the reason that.
Yeah.
So I don't know if you can just talk about that, because I think a lot of caregivers experience that of like, this is fully on me and what it is to carry that around and kind of live with it.
It was exhausting and scary for two reasons. The first being that it was such a prominent part of my day-to-day and week-to-week and month-to-month caregiving that it got exhausting for me. And the weight of that responsibility, the feeling of his life was in my hands, which it very much was the entire time, that was exhausting and scary.
Yeah.
But I think what was equally as exhausting and scary, and I know that my experience is not unique. At the time that I was taking care of my father, our journey began when he was basically 90 years old. So he was a very older adult. And so many assumptions were made about who my dad was and what care should be delivered to him based on the date of birth on his hospital wristband. And my dad, when he wasn't hallucinating and he was oriented, was fully functional. He was a musician. He was writing music. He was engaged with life. But I found myself trying to repeatedly convince members of the teams that what they saw in front of them was not his permanent lived reality. And that led to a greater level of frustration and exhaustion for me. It got maddening at times because I, as his caregiver, was challenged daily, weekly about the care that I was advocating for. So there were sort of multi-levels to my own personal exhaustion around it. I think what was helpful was actually just articulating, wow, this is really part of my job. My job is to be his voice. I think it can be really helpful just to acknowledge that.
Yeah. That alone. And then the advocacy piece, we try to bring up a lot as like, this is something that you will have to flex a muscle on and like learn to do it. And to your point, even people who do this all the time, like when my father had a stroke and I found myself in the ICU, and I talk about this all the time, but even for me in that moment, I had to kind of like gather myself and figure out what is the best way to do this. I don't know if you have any suggestions of just like things to start out with, because I think there's also a power dynamic at play when you step into a clinical setting where you are not the expert anymore. You're just a person associated with this other person. Do you have any suggestions for family members on like just things to say or like how to say it in a way that may get a response and help you advocate for your person? Because I know it's just straight hard to speak up in that scenario and say, is that true? Or we don't want to do that. Like, it's very difficult to push back. So do you have suggestions for people you work with?
Yeah, I mean, well, the first suggestion is a suggestion I give for all before any difficult conversation, which is just take a deep breath. Just take a really deep diaphragmatic breath that's in through your nose, held for a few seconds, and exhale slowly through your mouth, because that'll ground you for whatever is about to happen. I think the more clearly you're able just to state, this is what my dad shared with me just a week ago is important to him, is really helpful. I will also say that one of the most important adjunct tools for me was I was constantly showing members of the healthcare team pictures and videos of my dad that were time-stamped, that showed him the day before this hospitalization, us talking about this New York Times article, listening to classical music, and him commenting on the music. And then he became septic and clearly couldn't speak, but just look what he was doing just a day ago, or 2 days ago, or a week ago. I found that really helpful, especially because my dad had this neurodegenerative disease that was so confusing. The presentation was so confusing, and because ageism very much played into our journey. You know, this is something else I think is important. I think I'm almost avoiding your question because I can't think of one specific communication technique that I used, but showing pictures and videos was helpful. But secondarily, with my dad's permission, every time we had an important conversation about his goals of care, his goals of life, I asked for his permission to audio record them. And what was so very helpful for me was that at times when I was asked to bring his voice into the room, I would then be able to listen back to those recordings to affirm myself that I was actually stating what my dad wanted, which was so important because when everybody is challenging you, oftentimes you actually wonder, wait, am I making the wrong decision? But having that documented for myself personally was actually really helpful.
I love
Especially
that.
around the experiences of his death and into bereavement, for me to be able to say, well, I helped him achieve an end of life experience that was what he wanted.
Yeah, I think that's an incredibly helpful tool just to be able to reference it, just like you said, and like check yourself against what you're thinking. And then I also think about just having those later after someone passes away. Like I don't have any sound of my mother's voice. So also to have that later and be able to listen to your person feels really important. One of the things that you just brought up about like, am I doing this right? And people kind of questioning you is communication with other family members or other people who are
Oh
kind
yeah.
of periphery to the care circle. That's a big one too, of maybe I'm the main proxy and I've got, other siblings or other family members or whatever it might be who are questioning my decisions. Thoughts on navigating that, people?
So complicated, right? I mean, you are really playing traffic cop. Oftentimes we are playing family therapist as well.
Yeah.
I think number one, to remember that your job as a family caregiver, yes, you might be asked to give information, but it's not your job to help other members of the family circle, the caregiving network, to feel a certain thing. Your job is just to convey that information. And what they do with that information is up to them. A lot of caregivers will come to see me because they really want help in navigating difficult conversations and dynamics with other members of the family and the outer circle, folks who might just pop in for the emergency and then leave. And I often encourage caregivers to use what we call the XYZ technique for communication. So it's, I feel X when you do Y because Z. Z is because. I feel X when you do Y because Z. It makes me feel really sad when you don't come to visit the hospital to see dad because I've been here every day for the past. And I think the XYZ technique is a really just simple way for us to articulate how we feel, what we feel, and why, without going further than that. It's just stating how we feel. And what somebody does with that information, it's up to them. But I think that could be really helpful.
That's another great, like those kind of little, the video recording or the audio recording and XYZ, like these are just little things to keep in your back pocket that I think are so helpful. I mean, one of the things that I think going back to like the no topic is also just saying to people, I can give you an update once a week or once a month or something along those lines. Like, hi, I'm doing this most of the day. I really do want to keep you updated, but it's just not possible right now. So this is what I'm going to do is this. And if you don't hear from me in between, it's because I'm taking care of myself or taking care of my person.
Yeah.
So I'm a huge advocate for also just kind of, like you said, setting that boundary and saying, this is how I can do this. Cause we've heard from so many people who, this person's texting and then this person calls and then this person wants this update, like figuring out ways to consolidate updates and
I
information.
love that. And if there is a family member who potentially is not able to help with a hands-on caregiving, well, maybe you can delegate to that family member. Your responsibility is the communication of the information.
Yep.
So that's your job now.
Right. Yeah, absolutely. Okay, I want to get more juicy stuff to go into. Oh, this is the extra juiciest. Caregiving as identity. I mean, you can probably just go straight into it. This living a life of caring for someone, especially with what you were saying, neurodegenerative diseases, where we're talking potentially a decade or more of time as a caregiver. So, I mean, identity in that moment, identity after someone has passed away.
Totally.
I mean, any thoughts
All
you
of
have
it.
on this? I think it just gets so
Yeah.
deep
This is
into
this is so
human.
big.
Yeah.
Yeah, this is so big. So often caregivers will say to me that I don't recognize myself anymore. I have become completely disconnected from who I am because I'm no longer able to work full time. I'm no longer able to travel. I'm no longer able to do the things that once brought me a sense of joy or groundedness or a sense of who I was. And that feeling is very, very common, that the caregiving role, the caregiving responsibilities overwhelm one's sense of identity. So again, I just want to validate that, especially for those who are in this role for months and years, which is most of us, right? Rarely is caregiving just a few weeks or just a few months. For those caregivers, what I often say, and I want to say to you, is that that's real, of course. And who we are authentically deep down does not change because of caregiving. Who we are as loving and caring people, who we are as individuals who enjoy nature, individuals who enjoy music or the arts, individuals who are funny, that doesn't change because of caregiving. And so I encourage you, if you are feeling like so many of my patients do, where they're just feeling like, I don't even know who I am anymore. Well, I want you to answer the question, who am I? And I want you to answer it from the perspective before you became a caregiver.
Mm.
And I want you to think about how you can reconnect, even in small ways, to that part of yourself. I was taking care of somebody who was in an incredibly long caregiving journey with her partner. She lived in Vermont, but they came to New York for their care at Memorial Sloan Kettering Cancer Center. And she loved gardening. They had a huge, huge garden, like farm-like situation. And so every day for her like self-care was gardening. But stuck in New York City, it's very difficult to garden.
Mhm.
And one of the things we talked about was how important it was for her during this long period of being in New York, taking care of her partner and navigating everything that was going on with her partner's illness, is how could she reconnect in even just a small way to that part of herself that loved being in the garden?
Mm.
And the answer was actually what you see behind me, which is she could do some window pots. She could do some little plants in their rented apartment here. And just the feeling of having her hands on the earth
Mhm.
reconnected her to that authentic part of herself that felt joy when she was in her garden. It's
Mm.
one example of many, but I do encourage you to think about who you are deep down and how can you, even in just a small way, reconnect to that part of yourself.
Mm.
There's another side I want to say, because I think so many caregivers, for them, the caregiving role is everything. And then there's other folks who come to me or with whom I've worked in the past who've said, I'm not a caregiver, I'm the daughter. I'm not a caregiver, I'm the husband.
I'm so glad you said that. Yeah.
Right. And so, this is not universal that caregiving is everything. And that for so many of us, caregiving is infused within these roles we've been talking about today. I think that I agree and I can appreciate that. I think there's great benefit too to expanding what one thinks about in terms of caregiving.
Mm.
We think broadly, and this is going into a different direction, so I'll keep it short, but in order for us from a public health perspective to do a better job of identifying the needs of family caregivers and developing support services for family caregivers, we need to identify family caregivers.
Mm.
And so many times individuals will not identify as a family caregiver. They'll say, I'm the daughter, the spouse, the partner, the friend. But then that almost does a disservice in the bigger picture because we're not capturing that individual as a family caregiver. So
Yeah, this comes up with us a lot of people just saying, I don't identify as that. Like it's a healthcare word that we've applied to you, the person, not
exactly.
you haven't applied it to yourself. And also reminds me how important it is to stay in that role of daughter, spouse, brother. You know, there's a lot of times when the caregiving piece kind of takes over, like you were saying, and you just want to be the spouse, the daughter, the whatever for a second. Like you want to get back to whatever that relationship is and not have to be patient and caregiver. I also want to do a little bit of a shout out to this concept when it comes to patients too, because I think it's so similar of like, I am cancer, I am heart disease, I am dementia after that diagnosis. So it seems like it's also happening on both
Totally.
sides of the coin. You're both going through this kind of, who am I now together?
Yeah. Thank you for acknowledging that. I also really appreciated when you open the idea of identity when one's caregiving journey has ended,
Mm.
right? When you enter bereavement. You know, I know for so many of us, myself included, it was disorienting to go from a period of my life where for years, my life orbited around my dad. And then all of a sudden, not only was he no longer here, but all of those responsibilities were gone. And it was just incredibly disorienting for me. And I want to just acknowledge that while for many of us, we don't want to be caregivers, we'd rather be doing many other things, that too, for so many of us is another loss when we go through the death of our care partner.
Yeah. Yeah, like what even fills your time? Literally the logistics of your day, like waking up and caring for someone versus that is no longer a responsibility in my life. It is a loss for sure. And I'm wondering also if you can speak to caregiving as an identity in a good way. Like I am so
Oh,
proud
yeah. Yeah. Yeah.
of
Yeah.
being this caregiver for this person. Like I care for them so well. I take their, you know, they're safe, they're clean, they're happy. And that's all beautiful and good. And then that person's gone and you don't have that sense of doing well self anymore. Like how does that then show up after someone has passed away?
So important. So I've lost track of the number of caregivers who've said some iteration to me of, I had no idea I was so strong until I
Mm,
became a caregiver. Or I found my voice because of caregiving. I was shy before, but after having to advocate for my husband with a million healthcare professionals, I've actually found my voice.
mm,
And while maybe at the point of a transition after a care partner's death, you're no longer in the day-to-day using those skills, the reality is that those skills have been integrated into who you are. And we emerge from caregiving as stronger, potentially more grounded versions of ourselves. And those skills will be carried forward. Those don't go anywhere. And I want to be very clear, it's not a silver lining here, right? This doesn't, I'm Allison 6.0, and it's not compensating for the fact that my dad's no longer here. But I'm acutely aware that I emerged from taking care of him as a much different version of myself. And that much different version of myself is carrying me forward into new areas of my life. And I think for all of us, especially those of us who are bereaved, it's really important to ask ourselves, well, what did I learn? How did I grow? How did I change for the better? You know, caregiving gives us a different pair of glasses or contacts, a new prescription in our eyes. It tells us what's important and what's not. You know, it tells us where we should be putting our energy and where we should not. And that's a gift.
mm. I love that. We have a few people that we know who after their person died, they've turned their efforts to advocacy for the illness that the person was living with, which I think is a beautiful continuation of caring for someone, is taking that energy and time and now putting it towards an organization or someone else who might need it, so that you are still kind of flexing that caregiver muscle if you want. You know, that's a way to kind of continue it forward and continue to include that part of you. So it's not like, okay, I'm caregiving now, I'm not, that's never happening again. This is kind of a way, just like you said, to integrate these new tools of you into
Exactly.
your life. Yeah.
Exactly.
Okay. I want to keep going forward because I got some other stuff. All right. I feel like I'm saying this for all of them. This is
Yeah.
huge. This is a huge part of it.
They're
Setting.
all huge.
I'll let you just
Yeah. I mean,
hop in.
I love this visual because it so speaks. I mean, I always talk about the elephant in the room, but like the big, heavy monster in the room. There is one commonality among every caregiver joining today, who's going to join virtually, and every caregiver here in the United States, across the world.
Mm.
Each one of us, regardless of our care partner's illness, treatment, or prognosis, is tasked with sitting with uncertainty, not knowing what the next year or month or week or day, or in many cases, the next hour is going to bring. And that uncertainty is so very difficult to live with. And it very much shapes the experience of caregiving. So I want to just acknowledge this. And I strongly believe that one of our tasks, one of our most important tasks as family caregivers, when we think about self-care and taking care of ourselves, is learning to sit with that uncertainty, is to learning to live with it and not allowing that monster under the table to overpower us every day. It's interesting. So I'm a clinical psychologist by training, and I learned this in graduate school, and it didn't really make sense to me then. But now in my work in caregiving, it makes 1,000,000% sense. When we worry or ruminate, so worry is repetitive thoughts about the future, so things that can happen in the future. And rumination is repetitive thoughts about the past. I woulda, shoulda, coulda. And of course, if we're worried about the future and ruminating about the past, we miss out on the present moment. Worry and rumination are strategies that we do to navigate uncertainty. It's something our brain does to help us actually deal with uncertainty, because it's something that we can do. And we're not doing it consciously. It's not like we're saying to ourselves, okay, Sonya, Allison, go forth and worry because you have this big bright pink elephant in the room. But it's actually something we do to regulate our emotions. But what we know is, of course, worrying about the future and ruminating about the past doesn't help, doesn't do anything. And a lot of what I talk about in my book, in addition to communication, which is a guiding theme, is how do we sit with uncertainty? How do we navigate worry and rumination? And how can we even use it to our advantage? You know, we as caregivers will experience negative emotions. That is fact. Anxiety, depression, post-traumatic stress disorder, all sorts of other things. That's real. That's going to happen. But I do think there's an opportunity, if we're stuck with these feelings, that we can learn to cope with them in a more adaptive way, and that thus emerge from caregiving, perhaps a more refined version of ourselves.
As someone who is both, I'm more of a worrier, less about the past, more about the future. So I can pretty much resonate with this. Is there a piece of it that is also just getting comfortable with uncertainty and worry and being like, okay, that's okay. It's okay to be in a space where the feelings are a little on the negative side, that they're not, that I don't know what's going to happen, and just being able to live in that space. I don't have the answer for that one. It is a hard one, but do you counsel people on kind of how to sit in this space, especially between, I mean, there's worry just in general of like life and death and what's going to happen. And then there's, you know, time between scans, time between procedures. What is this test going to show? Where you're sitting in that, holding multiple possibilities in one place and not knowing which way it's going to go. Do you have coping techniques for
Absolutely.
caregiving patients, frankly?
Yes. So, and I'm guilty as charged. I'm a worrier. This is a continual challenge for me. But it's really learning to stay in the present as much as possible. Because of course, one of the challenges is if we are in the future or the past, then we miss out on the present, and those are meaningful moments with our care partners. I'm going to use another elephant here, but it's a silly example. But if I say, Sonya, do not think about a bright pink elephant for the next 5 seconds, absolutely no bright pink elephants whatsoever. It's nearly impossible to not imagine some iteration of a bright pink elephant walking in your brain, right? It happens. And so what we tend to do as humans when we feel discomfort of any kind, such as anxiety and worry, is we tend to avoid. We avoid by distracting on our phone, scrolling through social media. A few minutes turns into an hour. I'm sure everyone here is guilty as charged for that one. Excessive exercise, using substances to avoid certain emotions. All of this is avoidance. What's going to be much more powerful is exposing yourself to the feeling and learning that you can actually sit with it. And maybe that's just for a short period of time. Second, and this is something I also talk about often throughout the book, is taking a moment to actually think about the thoughts that we're worried about. Think about the thoughts we're having. And think about the worries. Are they realistic? And if they're realistic, is there anything that we can do to problem solve around them? And if they're not realistic, well, what can we do right now to help ourselves sit with a difficult emotion? Many caregivers will say to me, I've heard this so many times, I am really scared that I will not be able to survive their death. This is a common worry I hear in our clinic. It's a worry I had too. But the reality is that I've yet to meet a caregiver who's not survived their care partner's death. The death inevitably was devastatingly painful, but they survived it. And so helping that individual to come up with a more helpful, adaptive thought, like, I'm scared that it's going to be extremely painful when my dad dies, but I can take steps now to establish support, is likely going to lower that worry just a little bit.
Yeah, I love that. The kind of like, is this worry a worry that I can even address in any way, shape, or form, or is this something that is out of my control? I also want to make sure to touch on the success and failure thing, because I think that's a huge piece of it too, is like, am I doing this right? Am I doing the right thing? Am I screwing up in some way? To your point of having your dad on voice memos, like, am I remembering this correctly? Like, how to gauge, like, you're feeling like you're doing it right, or you're screwing it up, or you're not doing as well as you could be. I mean, I think, again, that's just naming it. But I'm pretty sure there's some version of that going
Yeah. Just like I said, worry and rumination is a strategy that our brains use to cope with difficult emotions. Our gauging success and failure here, it's rumination. Did I do it right? Did I mess that up? Did I lead to his death? Could I have prevented this? These two are things that we all do to try to take control in situations in which we are powerless. I just want to label that. That the time that we as caregivers, all of us who are spending so much of our time and our energy and our heart and souls giving to another, to go back and worry about that one thing or those two things, that is our brain's way of trying to take control in a situation where we feel powerless. And in a situation, it's, well, my dad's no longer living. Right? It's not helpful. I'm going to use myself as an example. There's one moment my dad fell. This was before his diagnosis of Lewy body disease. He fell at home, and I blame myself for it. And I keep going back to this moment. It's the only moment in my caregiving journey. And this was even before I would say I'm officially a caregiver. It's stuck in me. And every time I go there, I'm reminding myself, Allison, stop. You were not in control of everything. You did the best that you could. And this is you trying to fix a situation. And what ends up happening in those moments is then I connect myself to what I really need to be feeling, which is grief. And it allows me to connect more authentically and more vulnerably to the sadness that is 5 years later still very strong.
I think that's such an important one to name too, is like, in the midst of grief, we can latch on to lots of other emotions and feelings and things that maybe I think I did wrong, or what would happen if I had done X, or whatever it may be. But really what it comes down to is there's the potential that that's taking us away from feeling our own sadness about the situation. And just like you said, trying to find a spot for control versus sitting in the fact that we may not have any in this moment. Okay, go to the last one. I know you wanted to connect on meaning and purpose, which like all the other slides, super important.
Another big one. Yeah, each one of these, we can't rank order them. They're all big. This is my favorite topic. And I want to just preface this with, I'm not talking about the power of positive thinking. I'm not talking about turning lemons to lemonade. That's not who I am as a person. It's not who I am as a therapist. But what I want to acknowledge is that suffering and meaning can coexist. That one is not one does not negate the other. They're not mutually exclusive. And though we can be in situations of suffering, caregiving is certainly one of those situations of challenge and limitations and losses. And yet at the same time, experience meaning, purpose, growth, strength, hope, love, while we feel demoralized, burdened, angry, depressed, and scared. And I bring this up. I'm so glad that we're making a point to touch on this, because I think it is one of the most powerful resources for us as family caregivers. It's an incredibly powerful vehicle to self-care, to do what we can to connect and reconnect to meaning in life, whatever that means for each one of us, because what we find meaningful is very unique to what each one of us. But it's always available to us, even our moments of greatest suffering.
I'm just taking a pause because I love the and part of this, because it's not one or the other. You're not devastated or happy, or everything is difficult, or everything is great, or you're finding meaning and purpose, or you're demoralized. Like, it's all, like you said, it's all these things together. And I think that's one of the messages that is so important here, is like, you can feel love for this person and also be exhausted and not want to care for them anymore. It's both. It's both of these.
And that, I'm so glad you used that example, because I think that what I brought up is warmth in my relationship with my father. He happened to be my best friend. But I think it's even more powerful to talk about the fact that we can derive meaning from caregiving, even in situations where we have a difficult or toxic relationship with our care partner. I had a patient who, she had a very difficult relationship with her mother, and her mother was emotionally abusive to her when she was a child. And my patient distanced herself. She said no. She created boundaries with her mother when she was in her 30s. And for about 10 years, they didn't talk. And her mom approached her, reconnected with her, tried to reconnect with her when her mom was diagnosed with an advanced incurable cancer. And there was no one available to take care of her. And this patient of mine was really struggling with whether or not she should even bother to open that door again, and what that would mean. And what we talked about was that she had no control over whether or not engaging with her mother would turn out well emotionally, right? We didn't know what was going to happen. But ultimately, the meaning that she could derive from it was knowing that she gave of herself in her mom's greatest moment of need. And while they never repaired their relationship, after her mom's death, this patient was able to say to me, I had been living for about 12 years with a knot in my stomach, and that knot is gone. And so sometimes it's even in the setting of these very complicated relationships that the choice to become a caregiver, the choice to give of ourselves on its own, can be very meaningful.
Well, I love that, because I can't believe I've never thought about this, is when I think of talking about meaning and purpose with caregiver patient dynamic, it's always in relationship to the person you're caring for. Like, what is the purpose here? The purpose is to make sure that this person is safe and comfortable and okay, versus the purpose here is for me to feel better about myself, or to grow as a person, or to flex a muscle that I haven't had before. And I never truly thought about this as like a meaning and purpose vehicle for yourself versus through the lens of another person, which I think is pretty powerful. Because to your point, there are many people who are caring for someone that they don't have a loving relationship with. So where do you find meaning and purpose when this is not there's not love and connection flowing between the two of you? So how do you get it on your own? Oh, it's good stuff. Okay, I know this is kind of perfect. So we'll stop sharing and we'll go to some questions. Thank you everyone so much. We had one, Ashley said, is caregiver the best term to describe us, or is it a term that is used to lump us all together? I like care partners, but what if I'm a parent not giving care, but support to my kids? The doctors are giving the care. Ashley, so I totally hear you. Like, I haven't come up with an answer. Have you?
So I don't have the answer, but I have a lot of commentary on this because this is actually, I want to say, and just thank you for the question, because this is really a hot topic right now within the caregiving science community. What is the right language to be using? And actually the National Alliance for Caregiving, one of their goals for the next year is to come to some more consensus on language we're using. Is caregiver the right word or not? I personally am okay with caregiver as well as partner and care partner. I can tell you the two phrases I'm not okay about, which is caretaker, which is just completely inaccurate, by the way, and informal caregiver, because all of us know there's absolutely nothing informal about what we do as family caregivers. But you bring up the other point that often parents who are parenting healthy children are referred to as caregivers. And that, from many of our perspectives, myself included, is not actually that accurate either. And so I think there's a lot happening right now around the language we're using. I would say for right now, if you're in a situation where you're asked to identify in some way, it's you sharing with healthcare professionals and others what you want to be called. Do you
Yeah.
want to be called the caregiver? Do you want to be called the care partner? Do you want to be called the daughter? And whatever that is what should go.
Yeah. Yep.
Yeah. Oh, I love
I
that.
also, yeah, I love all of that. And the language thing is so important. And again, I think it's like a healthcare word that's been applied to people who are not within
Completely.
healthcare. So we're like, you're a caregiver, you're a patient, that's what you are. And it also works to kind of like separate us in a little way when in fact, there, what is that famous quote of like, we're all going to be caregivers at some point? Like it's just a
Yeah.
human thing to care for another person, be they a child, an older adult, your spouse, your family members. Like it's just, it's not a caregiver thing. You just show up in that way, in the same way that your client showed up for her mom that she didn't have a great relationship with. So yeah, Ashley, I'm with you. Like the language is not great. Human being,
Yeah.
something. But to your point, like, what do you want to be? You're the daughter, you're the something.
Yeah.
What is that title? And just knowing that within the healthcare system, they're using it as a signifier of like, this person is the person that I talk to about your care, but
Okay.
it's not necessarily how we're feeling on this other side. Let me see this other question. This is about your XYZ comment. It's just an example. I feel sad when you don't visit because, let me see, I feel sad when you don't visit because versus I feel sad when I don't see you visiting. So she's also wondering, making a request afterwards might help. Like, what would you be willing or able to do?
Yeah, I think that's absolutely wonderful. Yeah, and that takes it a step further, and
Yeah.
makes it clear. It's usually when we use that XYZ technique, we're usually saying in some format that our needs are not being met. And so I think it's wonderful to then say, well, here's how you could help my needs get met.
Lovely. Let me see. We got some other questions. Looks like we're pretty good here. Great. Do you have any suggestions for people after that caregiving experience, after I mean, in this case, we're talking about someone who's passed away, not necessarily someone during the course of an
Yeah,
illness.
yeah.
Where should they go? Where should those energies go? What can they continue to do to kind of fill themselves up in that way and not like lose that piece of
Yeah,
themselves?
yeah. So I think it's important first to acknowledge that not every one of us is going to want to remain connected to that caregiver role part of ourselves. So I just want to acknowledge that it's not what everyone wants. In fact, I've certainly met caregivers who say, I'm done. I don't want to even think about this ever again. I don't want to have anything to do with caregiving. And that's perfectly fine. There's no right or wrong answer here. For those of you who may feel that existential distress that comes with, but who am I now? Right. I think it's very important to, number one, not rush into anything. Of course, giving yourself space in grief to just grieve and grieve the loss of the caregiving role is important. But I think eventually to consider, well, what is it about caregiving that I want to now continue to honor within my own life? Now, I'll give you, there was one person I'm thinking about who absolutely switched careers as a result of caregiving, worked in finance and now is a nurse, because caregiving highlighted for this person just new strengths and new desires and goals. And so there could be a complete reorientation of one's life. But I think it could be even smaller than that. how can you continue to connect to that giving part of yourself day to day? What was so important to you about caregiving, and how can you give that to others? And perhaps it's as simple as, again, those are skills that are going to help you in the workplace, for example. I think for so many of us, the skills we derive through caregiving are actually really helpful in our day jobs. And not just for those of us who are caregiving scientists. I know I'm a unique case where my work and personal life are very similar. But I think that, just asking yourself the simple question of, what did I love most about myself as a caregiver? And what do I want to carry forward now that I'm no longer actively caring for my person?
I love that.
Yeah.
I love that. We got a question that came in. Colleen said, what basic recommendations do you have for oncology and or healthcare settings that do not have a caregiver clinic staffing to provide individual support count? Yeah, that's a great question. So you're in a unique
Thank you for
patient.
that.
Yeah.
Thank you for that. It's a perfectly timed question. So I am on a very, very significant mission to change this. And actually have just published with the American Cancer Society a toolkit to help cancer centers develop correlate clinical programs to the one we have at Memorial Sloan Kettering. We're actually in the midst of a webinar series with the American Cancer Society that is open to everyone. And the webinars have been recorded that are helping to provide guidance to cancer centers across the country. And I'm also waiting right now, fingers and toes crossed, for funding from the National Institutes of Health. And I'll say, when funded, cautiously optimistically, when funded, will give us the ability to train 200 cancer centers across the country to develop correlate clinical services. It has been too long that the Caregivers Clinic at MSK was on its own, and we have a model, we know it works. It's time to replicate and disseminate. So that's my mission for the next 5 to 10 years, is to make sure that this model of care gets out to other cancer centers and more broadly disseminated across healthcare systems broadly.
Yeah.
There should be services available for family caregivers in every hospital.
So in the meantime, while you're doing all this amazing work.
In the meantime, while we do that.
Yeah, what do you suggest? I mean, one thing,
Yeah.
have them come see us at
Yeah,
Mettle.
exactly.
This is exactly what we do. But what do you suggest
Yeah.
to other people who don't have that resource?
Yeah. So number one, I always say, first of all, ask the social worker associated with your care partner's team what services are available. Because even if it's not, it might not be advertised on the website or publicly available, there may be a social worker whose practice is focused on family caregivers in that hospital. Number two, that Department of Social Work will very frequently maintain a very comprehensive list of referrals to the community and organizations that are focused on providing support to caregivers. So I strongly encourage you, just ask what's available.
Yeah.
And then, of course, there's phenomenal organizations like Mettle Health, organizations such as the American Cancer Society, which do develop resources and tools and services to support family caregivers.
Yeah. Always ask a social worker. They're the best.
Always, always, always.
Allison, I have a question for you.
Please.
So through your experience of caring for your father, do you feel now that you will make different choices about your own care and your own end of life based on what you went through with him?
I love this question. Thank you for putting me on the spot with this. It's good. The biggest mistake my parents made, I should just say very quickly, 1 year into my caregiving journey with my dad, my mom died very suddenly. And so it was a period of trauma and loss and a lot of complications. And we had not had open conversations as a family, about finances, about goals of care, healthcare, about insurance, long-term care, Medicare, Medicaid. And so I was really going blind into this. And it's certainly not what I want for myself and my family in the future. And so what I have been inspired to do is speak very openly already about my own goals of care, to execute documents such as healthcare proxy forms and living wills and all that jazz. I've done that because I don't want to put anyone in the circumstance that I was put in. And so it's just really motivated me in that way, logistically, to be very clear and communicative. Now, one thing I always say, and it's important for me to say it here, is that goals of care change. So everything I'm sharing in 2024 will change, of course, God willing, I'm here in the next 40 years and changes, and then those goals will change and we'll have to have repeated conversations. But I have been very communicative about it. I will also say for all of us, I know this is likely the case, but just going through the death of both my parents in a short period of time and going through taking care of my dad and witnessing his decline and witnessing the challenges of our healthcare system, I'm just so appreciative for what I do have in my life and for the people in my life and for the moments I have that are healthy and positive. And they're just such gifts. And we all know it can all change in an instant. And I just feel very grateful, and caregiving gave that to me.
Mm. Yeah, there's something about having an experience and then comparing your own, what you want next to it versus doing it in a vacuum of, I'm just going to make this decision without any context whatsoever. I think it's a powerful tool to help people define, this is what I want for myself, or this is not what I want for myself. And hopefully it'll encourage people to have exactly those conversations. I try to bring it up with my dad all the time, just random, someday I'm going to be changing your diaper, just get ready. Like, this is part of it. So what do you want to do
Yeah.
when you die? Like, it just trying to casually work it on in there.
It's
So that
so important. I wish I could have had these conversations with my mom, and I never did.
yeah. Yeah. Well, we are perfectly at time. I don't think if anyone else has any other questions, Amanda or Allison, you covered so much good information, which I think is kind of at that level of just understanding this, what it is to be a human being caring for someone else versus like the practical tasks of like picking up prescriptions and making meals and all those things that I think everyone realizes goes into caregiving. And then this piece of it, this kind of understanding the dynamics, meaning the relationship between you and this other person, is really where the good stuff is, and that other stuff can just kind of be integrated into it. So thank you so much for
Of
being
course.
with us and sharing all your experiences and expertise. We're thrilled to have had you. Thank you.
Thank you so much for having me. Such a joy to be here.
Happy weekend, everyone. Thank you for joining us. Bye.
Take care.